I'm Dr. John McCann, and I'm going to talk about chemical peels. Chemical peels reduce brown spots and fine wrinkles. This is mostly a side effect of sun damage, so chemical peels benefit people who have sun-damaged skin. Chemical peels work better for the fairly complected individual, and I shy away from giving them in Black, Hispanic, or those with olive skin. Fortunately, people with darker skin have less sun damage. The safety of chemical peels is a common concern of patients. It turns out that there are 3 different kinds of chemical peels. There are superficial chemical peels, which can be performed by my master esthetician, and these are extremely safe. There are medium depth chemical peels. Those are the kind of chemical peels I perform. And then there are deep chemical peels, which are analogous to deep laser treatments. I do not perform deep chemical peels or deep laser treatment, and the reason for this is because they've had a tendency to cause depigmentation of the face, and I find that this side effect is largely not avoidable. That's why I stick to medium depth chemical peels. When performing a medium depth chemical peel, we spend a lot of time wiping the skin free of any fat or oily secretions with alcohol pads. After the skin is completely clean, the trichloroacetic acid is placed. We treat the face in zones, with usually the forehead being one zone, the eyelids being the second zone, and the lower part of the face being the third zone. We wait for each zone of the face to reach a visible endpoint in which the skin turns slightly white. At this point, we're able to stop the chemical reaction. It takes about 2 weeks before one can be back in their makeup after a medium depth chemical peel. This is usually when people consider themselves to be recovered. The recovery from medium depth chemical peels is painless, and this is very different than getting a deep laser peel. The difference is that when you have a chemical peel, your skin doesn't really peel off until about 5 days after the treatment. With either a deep chemical peel or a deep laser treatment, the skin is lost at the time of treatment, and because it's lost, you're without skin for a week. This is both painful and increases the risk of getting an infection. But from a purely medical standpoint, you can achieve the same results with chemical peels that you can achieve utilizing laser, but it's less expensive. And also, compared to many laser peels, chemical peels are easier to recover from.